Britain's chief medical officers have raised the nation's official COVID-19 alert level amid warnings of 50,000 cases per day in October if transmission is not brought under control. Chief medical officers say cases are rising exponentially as residents await new coronavirus restrictions to be announced by Prime Minister Boris Johnson.
A warning delivered from the heart of government. The COVID threat escalated to level 4. Hundreds of possible daily deaths, transmission rising exponentially. But these men striding towards Downing Street are scientists, not politicians. Their evidence is about to impact us all.
By mid-October, you would end up with something like 50,000 cases in the middle of October per day. 50,000 cases per day would be expected to lead a month later, so the middle of November, say, to 200 plus deaths per day.
Hospital admissions are rising. Older patients are becoming infected. It's why millions of people across the country are already living under local restrictions. But this could be just the start of a long and difficult few months.
So we have, in a bad sense, literally turned a corner, although only relatively recently.
The warning from Downing Street is that the virus is not getting weaker. These words will resonate in hospitals and waiting rooms across the country. Dr. Vinesh Patel has already seen a huge rise in suspected COVID-19 cases.
The scary thing now is that we're heading into the winter months, so all the problems that we faced back in March, it feels that it's 10 times worse now.
Scientists usually steer clear of talking about the economic impacts of lockdown. Today, though, there was an acceptance that finding a balance would be challenging. The scientists can only advise. Ultimately, what happens next is down to the politicians. Ashish Joshi, Sky News.